Good evening, I am Madhurima Datta, Zoology and Biology educational content creator. Now's content for class 12, CBSE, ICSE, all boards and also NEET aspirant students. Unit 1, Reproduction, Chapter 3, Reproductive Health, and today I will discuss about the medical termination of pregnancy, and its short form is MTP. Is the MTP or medical termination of pregnancy? It is commonly known as induced abortion. Abortion means fully destroy the fetus. This is called abortion, which refers to the intentional or voluntary termination of pregnancy before full term. Full term means it is a duration of 6 months of pregnancy. Definition of the MTP or medical termination of pregnancy: intentional or voluntary termination of pregnancy before full term. Around 45 to 50 million MTPs are performed annually worldwide, accounting for roughly 1/5 of the total number of conceived pregnancies. Next, legalization in India. The government of India legalized MTP in 1971 with strict condition to avoid misuse. That is, misuse means female zygote destroys, which is the legally banned, especially female feticide. Next, MTP Amendment Act 2070. Pregnancy can be terminated within the first 12 weeks on the opinion of one registered medical practitioner, and if the pregnancy has lasted more than 12 weeks but less than 24 weeks, opinion of two registered medical practitioners are required, because after 12 weeks there are many complications can be occurs in mother. Next, key conditions for permitted MTP. That is, continuation of the pregnancy involves a risk to the life of the pregnant woman or gravity of physical or mental injury. Next, substantial risk that the child, if born, would suffer from the serious physical or mental abnormalities, failure of contraceptive device or method used by the couple, and pregnancy caused by rape or sexual assault. And genetic diseases, if a fetus can be survive in genetic disease, that is Down syndrome, Turner syndrome, etc. And apart from this, unwanted pregnancy. Next, safety and risk timelines. First trimester, that is the up to 12 weeks, considered relatively safe and carries low risk to the mother. Next, second trimester, that is up to 24 weeks, much riskier because the fetus becomes intimately associated with maternal tissues. Next, major issues and misuse: female feticide, that is illegal determination of the sex of the fetus followed by MTP if it is female. And last is the unqualified practitioners, that is performing MTPs illegally in unsafe environments leading to high maternal mortality. Next, mechanism and methods of the MTP. MTP methods depends on the gestational age of the fetus. First is non-surgical methods. It is happening up to 9 to 12 weeks. Non-surgical methods, which is the acted by only medicines. That is, first medicine is mifepristone, that is RU486. It is an anti-progestin drug that blocks the progesterone receptors and detaching the embryo from the uterine lining. And next is misoprostol. It is a prostaglandin analog administered 24 to 48 hours later to induce uterine contraction and expels the embryo. The side effects of the misoprostol and mifepristone is heavy vaginal bleeding, uterine cramping, and nausea. Next, surgical methods. It is happen in 12 to 24 weeks. First is vacuum aspiration or dilation and cartilage D&C. It is involves widening the cervix and physically removing fetal tissues using surgical instruments. It is a painful process. Next, why MTP is performed? First cause is prevention of unwanted pregnancy caused by failure of contraceptives used during coitus or cases by sexual assault or rape. Next causes is therapeutic reasons. That is essential when continuation of pregnancy proves fatal or causes is severe physical mental harm to the mother, and also fetus carry any genetic disease and abnormalities. Next, eugenic reasons, that is significant probability of child being born that the severe or mental physical disabilities. Next, interconnection with amniocentesis and feticide. Amniocentesis, it is a prenatal diagnostic technique where amniotic fluid containing fetal cells is analyzed to detect the chromosomal disorders, that is Down syndrome, sickle cell anemia, etc. And misuse first is sex determination and female fetus murder, etc. That is often misused analog site sex determination techniques to selectively abort female fetus, that is female feticide. Next is statutory ban, that is sex determination via amniocentesis or ultrasonography is strictly banned under the PCPNDT Act, that is Preconception and Prenatal Diagnostic Techniques Act. Important question for the class 12 annual exams, that is why is MTP considered safe up to 12 weeks but risky after that. First is during the first trimester, the fetus is small and not intimately integrated with maternal tissue. By the second trimester, vascular connection and placenta formation make surgery complex with higher risk of hemorrhage and infection. So, to prevent the maternal mortality caused by unsafe and illegal abortion, and to provide the safe termination option in case contraceptive failure or medical risk. Now the topic has ended. For all video of class 12 and NEET, please subscribe my YouTube channel Biogenesis by Madhurima and follow my Facebook account Madhurima Datta. Thank you everyone.